It is the second portion of our training program. We are in a private hospital where we'll be having 3 cases. 2 SVF cases for anti-aging and for pain management, and we have a wound care. This time we're going to use bone marrow plus some exosomes. Let's see how it's going to turn out.
So here we are in the operating room. Dr. Melik just finished liposuction. In this patient, we're going to do a fat transfer to the face, assisted with stromal vascular fraction. Now that we obtained the fat, we're going to come to this area and process the adipose tissue to obtain the stromal vascular fraction. They have everything ready here, as you can see, and we're going to be showing the doctors how to manipulate this portion of the process. In terms of laboratory equipment, we have a centrifuge. This centrifuge has certain characteristics. The most important one is that you need to be able to fit 50 milliliter tubes in the buckets. And then we have here a precious piece of equipment that is the shaker incubator. The shaker incubator would give us temperature to incubate the collagenase, and also once we put the fat in contact with the collagenase, we'll be doing the shaking and keeping the temperature for a certain period of time until we're ready to come to the centrifuge and obtain the cells from the adipose tissue. We're planning on getting 10 milliliters of bone marrow on this patient because we're going to be treating 2 diabetic wounds. So the first and most important thing in this process is that we need to heparinize everything that's going to come in contact with the bone marrow, because the bone marrow has well-known hypercoagulability, so we need fluid.
See you guys practicing and successful and doing regenerative medicine along with our group. Hoping to see more of you in the near future. Thank you.